Hopefully, you people are listening to the videos, whatever is posted. 2 weeks, some 12, 13 videos should not be a big problem. It'll be a 1 hour session, and you can pause it and replay it and see also. It's all up to you actually, but make sure you see it fully because the main subject is there in the video only. Now we are discussing the subject. If you're confident about the topic, you can just go with I mean, what usually your senior batch or the previous batches do is they will play at 2x speed. Okay, because the class will be really slow usually, so that even the what to say the person who has not got exposed to the subject so far, in some colleges they might not teach also, those people also should be able to pick up the lesson. That is why it was quite slow. And if at all you feel that already you have learned the subject a bit in your college and you have also done some homework with that, you can go with 2x speed and finish the particular topic. See, sometimes it is like you have something in hand, and that might be a very essential one. But because you have it in your hand, you might feel that it is like I can watch it later, I can take care of it after some time, or it is already in my hand. Why should I make more effort for that? So don't think like that. Many people did this mistake only. Okay, but it really reflects in the result. All the time we will be telling study, I mean make use of the video. Whenever you're traveling, you study. All these things we will tell, but everybody will be busy in other work. But when the result comes, it will be like, sir, I could have studied before, can I join back? All those things are there. So please don't make the same mistake what others are doing. Okay, always I usually have one principle. What I usually follow is, if it is good, learn from your experience. If it is bad, learn from others' experience. If somebody is telling, I have failed, I have, what to say, I have failed a task, or I have committed a mistake, ask them how it happened and make sure you never do that. If somebody is giving you a good, I mean, I reached this success and with my experience, I am telling this is the way to follow that, but it might not apply to you. You can take a different route also, but your ultimate aim should be success. But if somebody has committed a mistake and didn't work out for him, definitely for no one it will work, because that is a wrong path. Or it is like what to say, it is not the way you have to work for that particular job. Okay, that you have to learn from others. Success might have different routes, but failures will have almost the same route. That is, you have not put that much effort. Or effort, maybe effort can be there, but it didn't come in the right time. Okay, or it didn't come in the right direction. Okay, so you have to change. That's all I'll say. Whatever work you have, once upon a time, I am really telling, if you people think you are doing a heavy load of work, I'll tell you, once upon a time our schedule was so much, what to say, tiring, but still we will get back to the books by evening. Morning, imagine there's a surgery posting. Morning at around 7:30 to 8 a.m., we will enter the department. Once we enter the department, already some patients will be waiting for that, for extractions. We will start, I mean, giving LA. LA will be administered sharp at 8 a.m. Okay, if at all for LA itself, around 10 to 20 people will be there. Once LA is given, one fellow will give LA first. And another person, I mean, maximum 2 to 3 interns will be there in a batch. So one person for OPD, getting the cards, writing what their complaint is. Already somebody would have referred from oral medicine. Just we'll see and check it and mark it as this 4-6 or 3-6, whatever it is, and keep the card in the table to the second person who will administer LA. Once LA is administered, That's all. That fellow's job is over. The third intern will do the extraction that day. So every day the routine changes. So extraction, first lot, some 10 chairs only will be working in most of the colleges. 10 chairs, so 10 extractions will get over. Okay, like that the extraction person, LA person will be always busy. OPD fellow at least will give the cases some to final year or third year for case history, all those things he will give and he will escape. But LA and extraction fellow, per day, they will do around each person, LA administration, one fellow will do, if at all he is very tired, he will come for extraction. Extraction fellow will go for the LA administration. Like this, both of them together, they will do 40 to 50 extractions a day. After that, some break will be there. After that, when you come, you will have to assist PGs for impaction or cyst removal or sometimes some foreign body lodgement. Apart from this, you will have final year people breaking roots. You will have to go and remove that. And sometimes sutures. Okay, with all these things by 1 o'clock or 1:30, we will have to wind up. Then we will go to the, what to say, canteen, have food, and then go to the library. Okay, nowadays I see interns doing on in total, in entire internship, only 20 extractions they are doing. For 1 month, 20 extractions. But they are tired with the work. Have in mind, tiredness or tiredness is mainly mental fatigue. It's mainly mental fatigue. You people have to really buck up actually. A mental fatigue will always say that your body is tired, you take rest, you just take a break, you just watch something else. All these things will come. Okay. If you are really interested in the work, what you're doing, the work itself becomes a relaxation for you. That is more important actually. I'm doing today one difficult extraction. I'm doing today I'm able to manage 20 cases a day. That is good. In your practice, it will be good. It is going to be very easy. Imagine somebody is coming and offering you 1,000 rupees for an extraction, and you are telling, no, five only I have practiced so far. Please, another 15 people, please leave. So you're losing 15,000 that day. Like that, you can't train your body and mind to do 5 cases and 4 cases a day until you are tired. That is very bad. I'm really telling you, people really have to work hard this entire year. You don't have a choice. You have a choice, but the choice will cost you so much. Either it will cost you so much or it will cost your time. So please remember, it is even time is precious, even money is precious. Okay. So I mean, you have time, you have to earn money. If you have time, really you can earn money. Okay. So if you want to practice all these things, tire yourself, then only your limits will extend. If you think 4 cases, managing 4 cases of tiredness, push yourself. Next fifth case, when I will get. Like that, you have to push yourself. Or what I'll study in the meantime. How fast I can finish these 4 cases. You'll have to train yourself. Nobody will teach you all these things. I'm really telling. Nobody will teach you how to manage 20 cases a day, how to manage 40 cases a day. It is going to be difficult. But if you put a clinic and people are waiting to offer you money and then get their teeth extracted outside, you will really feel, oh my God, why didn't I get a good training? Okay, so that's what. So please be active. Please be active. Activeness is very essential here. You might have some different job scenarios a day, but finally you will have to sit at one particular time and study also. So that should be your criteria. You have to do that. Otherwise, someone else is going to do that and they might get the better rank. Have in mind. Okay, train yourself. Internship, so many cases, train yourself to handle that. Okay, there is so much to study, train yourself to handle that. One day you will be doing both. much in a much bigger volume. Okay, that time you can't complain. Here you are paying money and studying. You're paying money and writing an exam. One day will come that others will pay you money for doing the job. That day you can't be an untrained person who can't manage things. So today is your day. Start managing. Put a timetable. This much time I'll do this work. I'll not carry a work to the next particular time where I'm going to study. I will study for this particular time. I'll be active. I'll eat what is required. I'll not overeat. This internship time is the time where many people are seeing overeating, putting a lot of weight. They are not able to sit and study. They get tired. Okay. So please start. Don't what to say. Make sure the particular topics are you all have covered and then you come for the discussion. That will only help you. Otherwise, discussion will be like teaching a theory class. That won't be nice actually. Anyways, so that's it for, I mean, that is your tip for today. You have to be active.